Today, we'll be discussing about third trimester of pregnancy. I'm Dr. Deepti Asthana. Welcome back to my YouTube channel. Now, the purpose of this video is to share some deep insights into the third trimester of the pregnancy. So, eventually, you have reached the last and most difficult part of your gestation, the third trimester. The third trimester generally starts from week 28 of the gestation till 40 weeks until you deliver. Now, this is the time when the baby is growing really fast and your body is actually preparing itself for the process of delivery. So hello everyone, I'm Dr. Deepti Asthana. I'm Senior Consultant in Fetus Hospital, Gurgaon and Director of Colosa Clinics. We'll be talking in detail about the third trimester of pregnancy. Now the third trimester can be both physically and emotionally challenging for a pregnant woman. The baby is considered full term at the end of week 37. And it's only a matter of time before the baby will be born. Researching and understanding what to expect during the third trimester can help reduce any anxiety you may have during the final stage of your pregnancy. Now let us see what happens to a woman's body during the third trimester. A woman may experience more tummy expansion, more pain, and swelling as she carries around her baby. A pregnant woman may also begin to become anxious about her delivery. Now, other events that occur during the third trimester include there's a lot of movement by the baby, there's occasional random tightening of the uterus which are called as Braxton Hicks contractions. Now, these are completely random and usually not painful. There's rapid enlargement of the tummy as your baby is gaining weight really fast. Now, after 28 weeks, roughly, baby gains around 200 grams of weight every week. Now, going to the bathroom becomes more often. There's heartburn, there are hemorrhoids, ankles and fingers and face, they become swollen. But mind you, if your swelling becomes excessive, please see your doctor to rule out any increase in blood pressure. Your breast may become tender and may start leaking also. This difficulty in sleeping and this increased fatigue felt by the body due to the growing baby and due to the extra weight of the baby. Now, what happens to the fetus during the third trimester? Now, at around week 22, your baby's bones are fully formed. The baby can now open and close its eyes and sense light. The baby's body will begin to store minerals like iron and calcium. By week 36, the baby should be in a head-down position. Now, if the baby doesn't move into this position, your doctor may recommend that you give birth by a cesarean section. This could be a transverse lie, a breech, or an oblique lie. Now, after week 37, your baby is considered full-time and its organs are ready to function on their own. The baby is now around 19 to 21 inches long and probably weighs anything between 2.5 kg to 3.54 kgs. Now, what can be expected at your visit to your doctor? Now, you will meet with your doctor more regularly during the third trimester. Now, after 30 weeks, visits become every 2 weeks. And after 36 weeks, they are every week. Your doctor may do a checkup of the vagina at 37 to 38 weeks to assess your cervix and the maternal pelvis. Now, your cervix will become thinner and softer as you near your due date in order to help the birth canal open during the birthing process. Now, how can you stay healthy during the third trimester? It is important to be aware of what to do and what to avoid as your pregnancy continues in order to take care of yourself and your developing baby. Now, what all should be done? You should continue to take your prenatal vitamins. You should stay active unless you are experiencing swelling or pain or any other complications as directed by your doctor. You should work out your pelvic floor by doing Kegel exercises, and you can also join any prenatal yoga classes. Eat a diet high in fruits, vegetables, low-fat forms of protein and fiber. Drink plenty of water. Eat enough calories, which is about 300 more calories than normal every day. Stay active while walking, exercising and doing yoga. Keep your teeth and gums healthy. Poor dental hygiene is linked to premature labor. Get plenty of rest and sleep. Now, what can you do to prepare for birth during the third trimester? If you haven't done this already, make a decision on where you plan to give birth to your child. These last-minute preparations can help you make delivery go very smoothly. Attend a prenatal class if you haven't done already. This is an opportunity to learn about what to expect during labor and the different options available for delivery. Now have an overnight bag packed and get ready with the items needed for you and the baby in the hospital. Develop a birthing plan along with your doctor. This may include deciding who do you want in your labor room for support, concerns you have regarding the hospital, the procedures, all the pre-registrations with your information regarding insurance and everything. Arrange maternity leave with your employer. Do maternity photo shoot and celebrate baby shower with your family. Now, what are the precautions during the third trimester of pregnancy that you should be following? Keep a check on your blood pressure and your sugar levels. Many women in the last trimester experience raised blood pressure and develop gestational diabetes. While these usually subside after birth of the baby, it's good to keep them monitored, and any fluctuation or discomfort should be reported to your doctor. Restricting strenuous exercises and intense activities at this stage is usually helpful, as your body is working overtime already to grow and nurture the baby. Now, this is also the time when your skin and belly stretch the most, thus increasing the pressure on your legs and other parts. Hence, strength exercises and high-intensity workouts should be completely avoided at this time to protect your body and your baby. Now, avoid flying on long journeys. Now, this is a very common question asked by all the patients. Ma'am, can we fly in the third trimester? So, it is advisable to avoid long flights, as due to pressure changes, you can have excess stress and pressure which can cause preterm labor and other complications. As it is after 34 weeks, airlines may not let you board the plane because of the possibility of an unexpected delivery on the plane. If you must travel during the third trimester, stretch your legs and walk around at least every hour or two. You should also be wearing compression stockings. Drink plenty of water and don't be dehydrated. You should also avoid sleeping on your back. Now, in the later stages, women usually find it difficult to sleep on their back, and this should also be avoided. This position puts pressure on the uterus and can be uncomfortable for both the mother and the child. Sleeping on your lap is advisable at this stage. You should also monitor your baby's activity levels. Your baby is very active at this stage, and it is an indication for the baby's health. Monitor your daily baby's kicks and movements and consult a doctor if there's a drop in the movement, and this could mean that the baby is under stress. Another easy way to count the movements is that in 1 hour post meals, you should be getting good 5 to 6 movements or perhaps 10 movements in minimum of 2 hours. So remember, in case your movements are a little lower, please go to your doctor. Your doctor might call you for an NST test or perhaps see your blood flow or amount of liquor around the baby through the scanning. Also, keep a check on cramps and back pain. The cramps and back pain can be an indication of preterm labor pains and should be accordingly updated to your doctor. This can also be caused by Braxton Hicks contractions and should not be ignored. Now, other symptoms may include vaginal discharge and tightening or simply the frequent urge to pee. Now, you should also sign up for prenatal classes. If you haven't already enrolled yourself, it's time to sign up with the prenatal classes and exercises that educate you and prepare you for the next step. From birthing exercises to baby care to even breastfeeding post-delivery, these all can be learned there. Now, have a birth plan ready, whether you choose to deliver at birthing center, whether you're opting for normal delivery or C-section with consultation with your doctor. Now, a word about baby position. Now, the baby is usually in head-down position. Do you actually know why? Now, the baby's head is actually the hardest part of the baby, and it tends to dilate the cervix better than the other softer parts of the baby. So, occasionally the baby's head could actually be over towards the mama's chest. This position is known as breech position. If you have so, the best way to deliver the baby would be through cesarean section. Occasionally, you also find that the baby can be in horizontal position, and these are known as transverse lie. Now, after 36 weeks, usually the baby's position settles down, and if it is a head-down position, the head may actually go down into the pelvis a bit more. This is known as lightening, and the head fixes into the pelvis subsequently. So, I wish you a very happy pregnancy, a very happy and successful birthing. So please stay tuned to my channel Calosa Gynae for regular video updates. You can also see my website drdeeptiasthana.com and calosaesthetics.com. Thank you for watching and take care.